Hi there, and welcome to Canceling COVID, an effort to address our community and to start letting everyone just get reliable information concerning what we can do as a community to try to help control this pandemic. We are suffering greatly, and it's a real issue trying to educate the community. Hats off to all of the healthcare officials, our community leaders, our politicians that are taking steps, positive steps, that is, to try and control this pandemic as it continues to rage in our community. My name is Tonya Rivens, a local radio and television personality, and I felt led to at least launch something that would connect directly with you and give you the information that is needed so badly. I was just sharing, I found myself today having to go out and get tested as a result of my son, who's on a basketball team in high school, and one of his teammates tested positive. And we know that nationally now we have quite a few deaths, and we'll talk about that as well. And surely that's an understatement when I say that, because we have at least 300,000. And then here in Mecklenburg County, the cases continue to grow and increase. I've read that we're getting about 670 new cases a day. And of course, that is something that I'll get confirmed in just a moment as we bring on our first guest. But I will say that we also need to talk more about vaccines and how our community is going to deal with that as we continue again to deal with this. This is our inaugural show, and I'm excited to launch it and grateful that you've taken the time to join us. Now, as you see, we've got a scroll across the bottom that gives you an opportunity to call for information as well as testing sites. And on our Facebook page, you've got an opportunity to participate in the poll because we're curious to find out if you're interested or if you will be one of the ones that will take the vaccine. And of course, that's a big conversation now in our community. Then to add into everything, we've got Christmas holidays and Christmas holiday, that is, and then New Year's. So we're in the holiday season. People want to travel, people want to visit with family. And it looks like over Thanksgiving, it didn't work too well. We've seen, or we're starting to see the spike as a result of that. And here we go again. You know, some people are like, I've got to go visit and I'll take my chance. So as we continue, this is an opportunity to educate you and to get you, again, credible, reliable information that is much needed in our community. And I'm so grateful that our first guest who's going to join us is he's the Mecklenburg County Deputy Health Director, and he's Dr. Raynard Washington. And first of all, I want to say thank you so much for taking the time to join us. I really appreciate you, answering the call when I reached out. And hats off to Mecklenburg County Public Health, because you guys are doing a great job on trying to work with the community. So welcome to you.
Are you doing? These sessions are Facebook and social media, and the internet is such a critical way for us to get good information out to our community.
So talking about getting information out, kind of talk about current efforts that are taking place. And I kind of quoted some of the information because Mech Health has done a great job too of getting like case updates and letting everyone know, where we are. And hopefully I quoted that correctly when I stated about 670 new cases per day. That's across the state. Is that correct?
No, actually, that's just here in Mecklenburg County. Among our
Yeah.
so folks who live here in Mecklenburg County, we are just shy of 58,000 cases in the county since this pandemic started. And so we've been experiencing a surge in cases over the course of the last several weeks. Part of that, of course, we do know is connected with activities and gatherings that took place or occurred during the Thanksgiving holiday. And so we're really working hard to get the word out to our community and really pleading with our community to stay home this Christmas season, stay home this New Year's, and stay just with those that you live with, connect with folks virtually as well.
So, Dr. Washington, what are current efforts that you can speak to? I'm aware that you all are working really hard, especially communicating the information. But any other efforts that you can highlight that is taking place concerning Mecklenburg County Health?
Yeah, of course. So, we since the beginning of this pandemic, we have been operating a sort of full-scale pandemic response here in the health department. We have a team of close to 200 individuals who are here every day of the week, 7 days a week, working to make sure that we are able to provide information to our community. Number one, we have a hotline that if you have questions, you can call and answer, and I see that scrolling at the bottom of the screen. We also have a case investigation and contact tracing staff who work to notify patients when they've been diagnosed with COVID-19 of where they can access resources and make sure that they are aware of what that diagnosis means and to identify their contacts and contact those close contacts to make sure those folks can get tested. We have a large team of individuals who are responsible for following up with those contacts, to follow up with employers, to make sure that they know when one of their employees tests positive. And then we have another team that's been helping support our schools to make sure that they can safely reopen, and that when they are open, that they are keeping our students as safe as possible. We also have a group of COVID ambassadors who are responsible for going out in the community. These are folks who have come on board in the last several months, and I believe we have 12 of them now, who are basically going out to businesses, small and large, and other types of establishments, to churches, to sporting places, to fitness centers, to just make sure that those owners and operators have the education they need to be able to keep people safe when they're using their businesses or services. We also have a team of social workers whose job is just to reach out to all of the patients who are diagnosed with COVID-19 to make sure they have the resources that they need to be able to stay home safely, so they don't have to go out to the grocery store, so they don't, if they have challenges with work, they can help them connect to financial assistance. And so our social work staff has helped so many of our patients. And so the team is working really hard. And as you've already mentioned, we have a whole other group of folks who are running our COVID vaccine operation. We're really excited that our first shipment of the vaccine came to the health department just yesterday afternoon. And so we have a group of our immunization program who are working really hard to make sure that we can get as many in our community vaccinated as soon as possible. The last thing I'll mention is we also have a group of folks who are working 24/7 at our isolation and quarantine hotel. And that's a hotel that we offer for those in our community who may not be able to safely isolate or quarantine in their own homes, if they either are homeless or some folks just don't have the space in their home. And so we have a hotel there for COVID patients who are able to stay with us until they are released from isolation, where we provide them with medicine, care, as well as food and all of the resources they need to be able to safely isolate and quarantine. So it's a large scale effort. Folks are
It's a lot.
and of course, and most importantly, we're trying to make sure that our community can easily access reliable, accurate, and valid information about this pandemic and how to keep themselves safe as possible.
So, Dr. Washington, I appreciate you sharing all that information. And one of the things, as I was listening to you talk about all that Mecklenburg County Health is doing, one of the stats that really stand out is it's close to half, or maybe a little more than half, of the deaths from COVID is that percentage is non-Hispanic whites. So, what type of efforts are being made that are focusing on addressing that community, the African American minorities, to try to lower this number?
Yeah, so one of the interesting things about our COVID trends, if you looked at our report that you mentioned earlier, is that we actually split out our deaths by community deaths and long-term care facility deaths. And that's important because our population that live in long-term care facilities look a little bit different than the rest of the community in terms of their demography. And we also have another team that works very closely with that group to try to keep COVID out of those facilities. Those are some of our most vulnerable residents. And when it comes to COVID-19, it can spread really quickly in those facilities, especially with staff going from room to room. So we've been working really hard since the beginning of the pandemic. We've been observing some disparities among racial ethnic minorities, particularly the Black community, our Latinx community. So we really had a whole community engagement strategy where we developed a number of outreach tools to be able to actually provide to community leaders accurate, timely information on how folks can protect themselves, how to stay safe, to make sure folks were aware and clear that COVID doesn't necessarily doesn't have any awareness of patients' race, but because the Black community in particular are already at higher risk for complications due to the fact that we have higher rates of chronic conditions that make COVID worse or make COVID more likely to be severe, like asthma, hypertension, diabetes. Because we already had those underlying disparities when the pandemic came, it essentially made us more at risk for severe complications, hospitalizations, and even deaths. And so we wanted to make sure that our community was aware, first off, that that was the case. We've also been very strategic and targeted in our testing strategy. We've worked very closely with our partners here locally, including our healthcare systems, Atrium and Novant, to make sure that in the communities that needed testing the most, the testing was brought to them. So we set up mobile testing sites in communities which still operate today. We have Atrium operates a roving site which actually moves around on a regular basis. We've engaged our faith community to make sure that the pastors, one, are doing everything they can within their walls to protect their community, but also serving as leaders and really playing a leadership role for those in the community and the resource. And making sure testing's available, making sure the word is out, and of course, making sure that access to those services, care, is free and available to everyone in our community is some of the most important things we've been doing to make sure that people are aware.
So, and my producer is working it out and trying to
I'm like, what's this going on?
information up as well. And I'm just grateful again for the efforts that you're making. You mentioned the faith community, and I know our Surgeon General for the country led a whole faith-based effort as well, reaching out to the African American community, even making phone calls to get pastors to get more involved. And Mecklenburg County Health, you and uh, Gibby Harris, doctor, you all, our medical director here, y'all have built a great relationship with our pastors already. Coming up later on, I do have a pastor that's going to talk more because now a lot of attention has been shifting to what role will Black pastors play, especially around the vaccine. And I just want to talk with you about that a little, kind of, I know it's a conversation that has to be one that's going to be transparent when
Yeah.
talking to the African American community because of past history. So I don't know if you all have the plans yet as far as distribution, but can you speak to that first and foremost, and then we'll talk more about these layers or how to build this trust to get more African Americans to take the shot or the vaccine?
Yeah, so the distribution planning is a rapidly evolving situation. So there are a lot of players at play. Mecklenburg County Public Health is one of those partners. We are certainly distributing the vaccine ourselves. We've convened leaders in our community, the healthcare systems, our other community providers, our federally qualified health centers, into the conversation in a working group that really sort of is sort of providing leadership to this space here in the county. But the Centers for Disease Control and the federal and state partners are really taking a lead on establishing at least a framework for our prioritization of who gets the vaccine and when. And it's really based on three basic things, sort of like who's at greatest risk for exposure, who's at greatest risk for complications, and who's most essential to the keeping our society operational and providing health and public health services. And so that's the general guiding principles. But aside from that, there's a whole process of determining which groups fall into which priority groups. And you probably have heard the 1A, the 1B, the 1C, the 2. And so some of that's still rapidly evolving. And so as that comes, as those guidance comes from the federal government, they come to the state issues additional guidance, then we consume that information and then make it operational on the ground. I will tell you that every one of those discussions, it doesn't matter if it's been federal, state, or local, have at its core recognized fully the need to prioritize and the need to recognize the importance of our racial ethnic minority communities in our prioritization. And I believe the state of North Carolina Department of Health and Human Services is one of the few states in this country that said up front that our minority communities will be given priority when it comes to getting the vaccine, and that will be a core tenet in our framework. So that's most important, right, to make it accessible. But then we have another whole mountain, as you've already described, when it comes to getting folks to actually get vaccinated, because vaccine availability, distribution is only as good as people rolling up their sleeve to get it. And so we're all aware, especially in the Black community, of the challenges that we've had with healthcare, with institutions, and with systems. And so for that, we know we have to, one, be honest about it and recognize it, and two, be very intentional in our messaging about what this process has looked like. There's so much misinformation. There's so much information at people's fingertips on a computer that we have to work against. So I think us being clear, being concise, being accurate and transparent, as you've already said, is most important. That's our goal, right? Our goal is we've already put together a community engagement arm that will be focused just on making sure we are engaging our community leaders, our community members in this process, that they have a voice in this process. Again, we are committed to equitable distribution. We will follow the guidance of the state and federal government, and we will make sure. I think the biggest thing to really be worried about or focused on is just one, making sure we establish trust. There's transparency in the process. People have the information about the safety. Sorry, the safety
That's
and
okay. You're busy.
the safety and effectiveness of the vaccine, and also to make sure that we make it easily accessible, so that we go into communities, we set up sites where people can make access to. We don't make it hard for our seniors to be able to make an appointment. We make it easy. I think those aspects of access are where we really focus. Because the prioritization framework will sort of be established at the federal, state level. But our job is to make sure that our folks in our communities who may not have smartphones or who may not be able to drive to this location or another location are able to get access. And of course, there's no cost or barriers to it.
So, Dr. Washington, Deputy Health Director here in Mecklenburg County, there's so much more that we could talk about. Of course, you're with Mecklenburg County Health, and I think I referred to Gibby Harris earlier. She's the Health Director. I think I said
Okay.
medical. But much respect to all that you all are doing. And again, always answering my call and inquiries. Hopefully, I can get you back on. This show is going to be weekly, twice a week. And we just want to be a vessel and assist in educating our community. And again, you mentioned about reliable, correct information
Yes, ma'am.
versus misinformation. And that's what we are here to do, to be an asset to get the information out to our community as well. We have got to get this under control.
Yeah.
And
Yeah.
my thought is, what can we do to help? So we're going to wrap things up with you. As we close out, is there anything else you would like to leave before we head over to our next guest?
Well, no, I'll just say thank you so much again, and I look forward to coming back very soon. And again, the situation's rapidly evolving, so as much as we can talk, that's great for us. So thank you so much.
Absolutely. Dr. Raynard Washington, again, he's the Deputy Health Director here in Mecklenburg County Health Department. Gibby Harris is the Health Director. But, hats off to these guys for even taking the time and really care enough for someone or for any individual reaching out and asking for information. It shows the value that they place in really reaching out to the community. And this is a Facebook Live show that I've been talking about launching for some time. I'm just glad that we're doing this because in my heart, I've lost two individuals this year, and it's been very painful. And you have to ask, what can you do to help educate the community? And so that's our effort now. Dr. Washington kind of touched on it. I did as well. Is the role of the Black church when it comes to vaccinations and how are we going to receive this? Recently, there's been somewhat of encouraging signs that more African Americans say they will take the vaccine, but most are kind of like, not for me, or I'm just going to wait and see. This program is only about 30 minutes. We could go on, but I've got another guest who's going to join us now, and he is one of the pastors here in the city. His name is Reverend Enrico White. He's Weeping Willow AME Zion Church. He's a good friend, and certainly I'm grateful that you're available to join us this afternoon as well. So thank you, Reverend White, for coming on and speaking with us.
Thank you, Tonya, for allowing me to be a part of this your first meeting. Thank you. Thank you for
Yeah.
and thank you for keeping us informed in the community. Thanks for what you do.
Absolutely. I'm grateful for the opportunity. And I shared with you an article that has been written about Black pastors across the country. Thank God there has been at least someone that recognizes that this is the way to get to our community. It's always been starting with the Black church. But, some pastors have been very transparent about, you know, which way do we go on this? Because there is a real history that has led to the fear in our community when it comes to getting vaccinations. And so some pastors are saying, I'm not so sure if I can endorse this because based on what has happened in the past. So I wanted to just kind of get you to share your thoughts on, or if any guidance or leadership has been provided on how the AME Zion Church or even Reverend Enrico White view this vaccine now that's been made available.
Well, I don't profess to be the spokesperson for the entire AME Zion Church, but I can absolutely speak on behalf of Enrico White. And let me share that, I myself found myself having COVID in April. Uh, Thank God that my symptoms were mild. I only lost taste and smell.
Amen.
And those were the only symptoms that I found myself dealing with. But continue to stress the importance of, things like my hand sanitizer, keeping sanitized, like so, those type of things, and stress that within our church community here at Weeping Willow, because there were several here at Weeping Willow that were infected and affected by COVID, and we had one death as a result of COVID. So it's a subject that is really, really close to my heart and close to the Weeping Willow Church family's heart. And we take very seriously, even but we're still virtually worshiping because we still take seriously being socially responsible.
And you mentioned that you all are not yet back in the building, and I think one point I was told that it may be the first of the year. Do you have any idea at this point when your ministry will be allowed to return inside? Now, granted, that's the building, and ministry has continued. I see you constantly, in addition to services and giving back to the community and hosting your programs. But have you received any information indication of when you all may be returning back inside?
Well, I personally have not made any decisions on when we at Weeping Willow are going to go back into the sanctuary. We want to, again, we want numbers to be down there. I want to be absolutely sure and secure that when the membership does come into the sanctuary, they feel safe. They feel as though their church is watching out for them.
So you mentioned also keeping the practice of physical distancing and wearing the mask and washing your hands and keeping the sanitizers close and safely by. And some ministries, I would say, they have made adjustments. They are allowing a small amount inside of the sanctuary. Some are hosting service outside. Of course, maybe the weather doesn't always agree, but as long as you're inside of your car, it kind of still works. I've attended some of those services as well. And I guess what I'm leading to now is how much have you had to change and adapt when it comes to hosting service as a result of this pandemic?
Well, we found ourselves having to be as creative as possible just to keep the congregation engaged. And we've always talked about the message is always the same, but the methods change. Well, we were really forced to change methods because of this pandemic. We weren't able to come into the building. We weren't able to have corporate worship. We weren't able to have all of the meetings that are always held at church. But that still does not negate the fact that we have to get the message out. Therefore, thank God for modern technology by way of Zoom and other avenues and venues by which we can still do that. So I think this pandemic for the church, has exposed some of our flaws, but it also has shown us a lot of our opportunities. I am able to reach more across the world than I ever could by those who could just sit the few hundred in the sanctuary. So there's some positives on that side of it as well, but we do miss that fellowship piece. And we do have, at least on first Sundays, we come together in the parking lot while they stay in their cars, and we have a corporate communion that way. Everyone stays in the cars, and I'm mask and glove, and we go through the communion that way, just trying to give some sense of togetherness, some sense of normality in this world that seems to be chaotic right now.
Okay, and as we start to wrap things up with you, Reverend White, again, thank you for coming on. I'd like to have you back on as well to talk more. There's a lot of layers to this that you just can't get in just 30 minutes. But I want to go back to this vaccine. Any suggestions or outreach ideas that you see? You're pretty innovative as far as how to get our community more educated on this COVID vaccines that's now available? Because you, as I know, there's a lot of distrust out there. And so, do you have any ideas of ways that we can get more of the community engaged and possibly included?
Yeah, and there's tremendous distrust and a lot of misinformation that has gone and continues to go out there. And I understand it. I get it. Historically, things have happened to our community and within our community. But as I take a look at COVID-19, it is overwhelming. Uh, Other populations are also overwhelmingly being affected. So things were rushed not for Black folks and not for African Americans, but things were kind of, they saw to it when it affects them, they got to hurry up and make things happen. Uh, will I take the vaccine? Well, I think there'll be enough time by the time the vaccine gets down to the common people like me that they'll have enough research and study to see whatever side effects are taking place. I look forward to being one of the ones that takes the vaccine. I'm excited that a Black doctor, Dr. Corbett, was one of the ones that was instrumental in developing the Moderna vaccine. And I believe that as I stand as a representative of Weeping Willow and show them, others may feel that, hey, it must be okay. It's safe. I can do this.
You make some great points, Reverend White. And again, I appreciate you taking the time to speak with us, taking time out of your day. I can see you're a dear friend. And the point that you just made, I think, speaks volumes that African American doctors were involved this time, and they have pretty much co signed on their efforts in being involved. And that is certainly one way to connect to the African American community. It certainly speaks to a change from the past. And so we're grateful for that. Thank you again for taking the time to speak with us. Canceling COVID again is the program. We're excited. We are now headed towards 1:30 already. Phew. Time sure does fly when you're putting out good information. Again, we have launched our very first show. Yay. Thank you to Amelia Henderson, our producer. We got some work to do. We had something in the screen behind me. We'll work through all of these, but for anyone tuning in, we didn't get an opportunity if you well, wanted to put some questions in the chat. So we'll work through that. We also have a poll on my Facebook page. We love your input on that. And as you can see, we've got a hotline number that's scrolling across the bottom that gives you an opportunity to call. If nothing else, make sure you get tested. I mentioned this morning, I was in the line to get tested. My son, one of his teammates, tested positive. So he had to go get tested, and so did I. So that includes the whole household because we want to be informed, even though we don't have symptoms. You know, if I am positive and don't know it without symptoms, they call that asymptomatic, and I go visit my mom or my sister or wherever I go. If I take my mask off, then I'm potentially exposing them. And that's one of the things that we have to keep in mind. Again, we've got so much more in store for you. We wanted to launch today. We'll be back next Wednesday. That would be next Wednesday and Friday at 1 p.m. So until then, as always, life's challenges make you better, not bitter. Have a Merry Christmas and please be safe and stay informed about COVID-19. Certainly, we're here to do our part. Thank you for joining us.